Hello, all right, we're going to start up now. We have a couple people still to join us, but we're going to go ahead and get started for those of you who are online, ready to go. And if you're not here, then you could watch this later. So what we're going to do, we're going to talk about limiting migraines. Migraines can change your life. Right? If you've got them, you know how bad that is. But eliminating migraines can also change your life for the better. That's what I want to teach you how to do tonight. So what's important to you when you think about your life? Not just think about migraines now. What's important to you? So why are you here? Why are you watching this presentation? What do you want to learn? I want you to really think about that right now. Is it getting out of pain? That's probably the first thing, right? What I want to get out of pain. I want to learn how to get out of pain. I want to learn how to do it naturally. If you're watching this, you probably have tried medications, maybe many types of medications. Some of them may work to get rid of the pain, but they also create new problems. So you want to learn something natural. We're going to learn that tonight. You want to stay active. A bad migraine can put you down and you're not available for your family, for your fun, maybe for your work. Stay independent as people get older. But even when you're not older, if you have a migraine, you're dependent on other people to take care of you or to do your work. You're going to stay comfortable and out of pain for sure. Perhaps improve or save the life of someone you love. Now, why do we say, isn't that a little extreme? Well, people who get on medications for pain relief, they become dependent on those medications. And that's a step from being dependent on medications that are addictive, that change your life, that motivate you wrong, or that have side effects. So we'll learn about the side effects tonight. So even though opioids aren't a typical approach for migraines, there are other medications that have life-threatening side effects. So who am I? So I'm going to let you look up a little closer to this. So family chiropractor since when did I start? Since 1996. It's been a long time now. So that's about almost 30 years coming up. Focus on nervous system and chronic health challenges, and that's why we talk about migraines and other chronic health issues. Certified in functional medicine and functional neurology, chiropractic neurology and functional medicine. Chiropractic neurology, that's where we use exercises, nutrition, adjustments, different ways to activate and nourish the brain to help it rehabilitate, heal, function properly. Functional medicine is one of those approaches where we use nutrition, looking for deficiencies, toxicities, food sensitivities, gut health problems. And a lecturer and member of Interdisciplinary Association of Functional Neurology and Rehabilitation. If you can say it 3 times fast, you get to join, right? And so, not really, but it feels that way. This is where a bunch of practitioners get together of different types, and we use neurology, teach each other about neurology, and talk about how we can help people recover and heal naturally. And the reason we get such amazing results in our office is because we have a different approach. And that approach is characterized by this term salutogenesis and by the term synergy. So salutogenesis basically means focusing on supporting human health and wellness by focusing on factors that create wellness, not focusing on factors that create disease, because no amount of focusing on disease is ever going to teach you how to get healthy. And what is synergy? Synergy is the name of our office, Synergy Chiropractic and Natural Health, but it's a combined effect greater than the sum of these separate effects. Synergy. And that may be including nutrition, neurology, education, exercise. And so those are things we use, we'll talk to you about tonight. The focus of time and money plus effort leads to a result. Everybody has to focus their time, money, effort. And what you focus on with those things will determine your result. You've got money, stockholders, serving mankind. These are different focuses, different groups. Right? So the manufacturer is going to be, let you see me here. So the manufacturer is going to be having a focus of serving mankind, but also they'll have to serve the stockholders. Right? Management for the doctor, they may have managed care. Hey guys, come on in. Right? So for the doctor, they may have a manager, they may be their insurance or management company. They have the patient's interest to consider, and as well as they have their own money. They have family to feed, so they have their focus of time, money, and effort. The doctor has their time, money, and effort focus. And the typical patient, you guys have your own focus. So you have time and money and immediate health, comfort, and enjoying life long term. These are things that you want to focus on. But everybody that you interact with has different focuses. So the manufacturer, who's the manufacturer? So whether it's a device or a medication or something, they have a focus. And that focus is going to lead to a solution. But they're not going to be the same solution. It's going to be different solutions, and you have to choose which one I want. So serving someone's focus. As you go through the healthcare system, you have to think, what is, not really, say, I guess sort of, what is the motivation of the doctor, but also what is the motivation of this information I'm receiving, whether it be from the doctor or from industry, whether it's advertisements on TV, on the internet, etc. So unfortunately, the patient has to consider all these things. And doing nothing or masking may not be an option. Like, well, I can just deal with it, or I can just cover it up with medication or other stuff. So in the JAMA, that's the Journal of American Medical Association, this research study says some patients with migraines with and without aura are at increased risk for subclinical lesions in certain brain areas. So brain damage, they're at increased risk. Any history, this is another one in British Medical Journal, any history of severe headache was associated with an increased volume of white matter hyperintensities. That's basically the same thing. It's a little damage in the brain. You're like, that's what it feels like, right? Like, I knew that. Women with migraine have a 150% increased risk of stroke. So these are kind of scary. So doing nothing is not really a good option, but just covering it up. It's like if you take your car to the shop and it's got a problem, the check engine light's coming on. If you just cover up that check engine light, well, you've got rid of the symptom, right, or whatever, but you haven't got rid of the cause. Same thing with medications and getting rid of the pain. If you don't address the cause, these risks still may be there. That's why we like to address things naturally. Yeah, there's your dramatic brain damage thing. Yeah. Traditional medical doctors rarely mention solutions other than drugs and surgery. Why is that? 97% of physicians focus on, I made up that number, by the way, but it's pretty close, I think, to true. Most numbers I won't make up. I'll tell you when I make up a number. Infection, disease, or trauma. That's what they're focusing on. If you think about all the doctor visits you've had, what are they looking for? They're looking for an infection, disease, or trauma. And that's great. You want people looking for that. If you've got migraines, do I have a tumor? Do I have a brain infection? Is there a parasite in my brain? That's right. That's what it feels like. And so you want that ruled out, and they're good at doing that. But then when you don't find any of that, they're not going to promote wellness. They're just going to attack disease, infection, and trauma. And countless lives are saved by their quick thinking, drugs, and surgery. So it's a good thing. It's not bad. It's just a different approach. And once that approach has run its course, then wellness is your option. But if you're looking for a wellness solution to a chronic problem, disease focus does not lead to wellness. It's kind of like trying to use a hammer to put in a screw. Yeah, you want a screwdriver if you want to put in a screw. So if you really want to get to the cause, you have to have the right tools. Natural solutions require a holistic evaluation. So the body works as a unit, physically, chemically, neurologically, or mentally, emotionally. But finding the cause and the right combination solution of solutions requires being thorough, because the same solution doesn't work for everybody. So we have to look thoroughly. And there are many solutions for migraines, and most of them work pretty well for most people. So I have a list of probably 10 or 15 things that I go through mentally as we're addressing these with people. And I usually don't make it very far down the list, but there still is a big list of things we can start pulling out. There's a saying, if you hear hoofbeats, look for what?
I'm guessing a horse.
A horse, right? Don't look for an antelope or a zebra, not here in Central California. But if you don't find horses, then maybe it's time to start looking for some zebras or something, right? So it's still possible, just not the most probable. So combine knowledge of multiple causes and solutions. By using dietary, nutritional, lifestyle, and biomechanical treatments, there's a 93% chance your headache will hurt less often, or completely go away. That's pretty cool. Huh? So that was from the Journal of Manipulative Physiological Therapeutics back in 1995. And is migraine a food allergy in the Lancet and other ones. All right, so nerve irritation causes your symptoms. This really is it. It's nerve irritation. Now we just have to get to the solution for nerve irritation, but let's understand a little bit what the cause is. Nerve irritation causes problems with clarity, energy, head, arm, low back, and leg discomfort. So it's nerve irritation and brain disturbances. And this is the chemical thing. Chemicals are irritating the nerves, and that causes pain, which it's interesting. Let's go back one. So nociceptors, what is that? It's a big fancy word doctors use for pain receptors, but pain is a perception in your brain. Nociception is sensory receptors that feed into those pain pathways. You can actually experience pain with other than nociceptors, but 80% of the sensation is actually going to unconscious areas. So it's not pain, it's nociception. But it is irritating, but it's not consciously irritating. You're responding to it physiologically, maybe increased heart rate or respiratory rate or blood pressure, things like that. All right, toxicity. So there's tension in muscles or lack of movement, and then you get toxins, waste products building up in the muscles, and that causes nerve irritation. Tingling, referred sensation, maybe it's tingling up in the head or down the arms or in the legs, and you may feel like carpal tunnel syndrome. This can be from nerve irritation. Brain fog. So that's those same toxins and tingling, irritating signals going up to your brain, and a lot of it's unconscious, but then the brain tries to interpret that, and this creates a brain fog. And so even when people don't have a migraine, they may have brain fog. They're like, well, I just kind of feel out of it. And of course, we know when there's a lot of pain, you feel out of it, but this is even when there's not pain. And injury susceptibility, because if these static information is feeding back into the brain and creating a brain fog consciously, it also creates subconsciously, where all of your stability of your spine and your joints is established. And so if you don't have proper communication and control, then you're more likely to injure yourself as well. All right, so all these things contribute to that: chemical, joints, posture, and mental, emotional. They're causes of nerve and brain irritation, which then causes symptoms. So migraines and any types of headaches have these certain causes. So we'll talk about each one of these. Rebound, ergonomics, muscle, joint, neck curve, mental stress, and nutrition. They all create nerve irritation and then migraines or other headaches. What about rebound headaches? So rebound, that's when you have, so rebound headaches are when you have, you take medication. We'll talk about on the next slide the specific medications you take and how often you take them, how likely they are to cause rebound headaches. So you stop taking medication, you took it for a while, you stop taking it, and then you get a headache worse than before, or the same one you had before. And that's a rebound headache. So the very solution causes the problem. And then what do? You take the medication again, and then you go off there like, getting better, and then the headache, right? So this is the rebound headache. Here's some medications. This was put out by an organization, Migraine Again. And these are just, there's no established exactly this number of days, but it gives us a guideline. Non-opioid analgesics like acetaminophen, aspirin, ibuprofen, these are really common. More than 15 days a month, very likely causing rebound headaches. Analgesics with caffeine, these are the ones that are most effective for migraines. They have pain relievers as well as caffeine in them. Taking that as little as 10 days a month will create rebound migraines. Opioids, greater than 10 days a month. Triptans like sumatriptan and elatriptan, 10 days again. And any combination of these things, 10 or more days a month, and you're likely creating the problem that you're trying to solve. What do you think about that?
That's interesting because so I went to a neurologist and she wanted to prescribe me, I think it was Nurtec, but I was scared of it, so I didn't want to take it. But I do have, it's kind of like a butabitol, so it's like butalbital, Tylenol, and caffeine.
Mm-hmm.
So it's like the top 3 things.
Okay.
And it'll help sometimes if I, do it early enough,
Uh-huh.
but I do think I get rebound headaches from taking it.
Yeah. Which stinks. The one thing you want to try to solve, you're creating. Okay, what about muscles? It's interesting. How do muscles create? Let's think an example of someone sitting a lot. So, or sitting with the more they have the alter, this is like perfect posture, right? AI created this for me, except for the nerve. They added those on. So perfect posture is helpful unless you're sitting there for a long time, and then it becomes a problem too. So you get toxins building up in the shoulders and the neck, and because of partly the arm position. So if your arm is too high, raised up a little bit, then you have tension in these muscles. And that tension then creates buildup of toxicity, just like the muscle is holding its breath. And so the waste products build up. But we'll come back to that in a moment. So you have toxins and inflammation build up. So toxins create symptoms. It can be from your food, drink, and air. So that's, of course, a source of toxins and irritation. You want to think about, is there something I'm eating? You want to eat really purely. Because what you bathe your body in on the inside is, of course, going to have an effect. Joint malfunction, subluxations. We'll talk a little bit more about that. Lack of motion or postural strains. That's when we come to this. There's no perfect posture for sitting 8 hours a day. You should not be sitting 8 hours a day. Right? So you want to get up and move around regularly. How often? 20, 30 minutes. It doesn't mean you get up for 10 minutes, right? Half your day is breaking. So 30 seconds, you might even still look at your computer. So get up, just do some spinal hygiene, move your body around, tighten muscles, relax them, and then sit back down. And then mental stress. Why does mental stress contribute to toxin buildup? Especially in the shoulder, which then leads to the arm, hand, neck, and head symptoms. It's because this is the part of the body that we emote with, our emotions. So this is how we express ourselves, right? I don't know. So the tension built up in here, even if it's not like that, a little tension builds up. And again, it's like the muscles are holding their breath. They do that for a long time, and then it creates symptoms. So then you get nerve irritation, and then referred pain, tingling, ache to the shoulder, arm, hand, neck pain, headache. So I have a checklist for desk ergonomics. If you guys want that, I can give that to you. Don't have it right now, but we'll get it to you. And anybody online, we can get that to you. Just let us know, send us an email or call in. So simple checklist. It's more complicated than what I have here, but first, it's the idea is you want to fit your workspace to your worker. Instead of fitting to your workspace, you go, okay, this is where my body should be. Then you roll up in your chair to the desk, and you're like, okay, now how should things be to fit my body? So start with your chair. So you fit your chair to your body, just away from the desk. How am I doing? And then roll up to it. And then your keyboard and your mouse. And so am I good posture here? Do I need the keyboard tray underneath? And that's usually the case. And then your screen. Your screen should be about the top third of it should be at about straight eye level, and about an arm length away from you. Your job. So what is your job? Do you have you're up and down a lot during your job? That makes a difference in what you do with these things. Do you use a 10 key a lot? If you use a 10 key a lot, then it shouldn't be over there. It should be right here, like where your mouse or keyboard is. Other documents, are you reading documents all the time? If you're using them, transcribing, or using those to help you look at, type something on the screen, then you need a document, like a document holder right next to your screen or propped up near close to it. And your phone. If you're on the phone a lot, I can see this. All right, that's no good. All right, if you're holding that phone and typing. So if you're on the phone a lot while you're also typing, then you need some kind of a headset or speaker. Then your environment, sight, sound, temperature. So sight, you want to make sure that there's not a bright light behind you or open window, not open window, but a bright window like sunshine, right? Where you're kind of having to move around. And often we don't do this consciously. Same thing about a bright light behind us. There's a glare on the screen. Turn your screen off and then see if you see a big glare. If you do, then you're probably, when your screen's on, subconsciously, you're probably trying to read around that glare, and you're holding your body in a weird way. And then focus. Oh, also, let's go to temperature. Temperature, if it's cool, if you have a fan or something blowing on you, that creates the muscles tighten up, and then waste products build up, and that creates a problem as well. So you just put more clothes on. Focus, phone, apps, other activities. Obviously, these things can be distracting. And then move your body. So even if you have all those things right, you still want to get up and move around. All right, muscles and joints cause nerve irritation and migraines. Subluxation and nerve irritation. So this is normal, where the spine and the brain's communicating to the organs, and it goes through the spinal cord. That's all normal. But a subluxation is where you have interference in that communication, and there's nerve irritation. And then the brain can't properly communicate to the organs can't properly communicate to the brain, and the brain, when it doesn't get the information it needs, it often defaults to pain. It's kind of freaking out. It's like a mom who doesn't know where her baby is. It's like, freak out is the right response, right? So same thing with this. Our brain is like the mama, spine is like the baby. Mama wants to know what's going on with the baby all the time. So why nerve interference and irritation matters? Because the purpose of the nervous system is to enable you to adapt to stress and live and stay healthy. So if we can't adapt to stresses, then we can't function properly. So key concepts of the subluxation is caused by stress. Physical, chemical, and mental. So not just mental stress, but physical and chemical. We talked about the physical stress of posture, ergonomics. Chemical is what you eat, drink, and breathe. And it's defined, subluxation is defined as a spinal joint problem causing nerve irritation or nerve interference. And subluxations initially are silent, but then they lead to symptoms that we feel. This gives us the idea how that nerve irritation can feed into the neck and causing all these symptoms. The trigeminal nerve, that's the nerve that covers our face. So we have 3 different branches of this nerve, but these nerves go to the meninges. The meninges are the tissues around our brain. Right? The blood vessels are also innervated or directed by the trigeminal nerve. And but these get feedback from C1 through 3. That's the top 3 vertebrae of your neck. That's why those are so important. And that's why a lot of people with migraines are from problems in their neck, because it's really interesting the way these nerves, this trigeminal nerve work. It receives information from the face and the meninges, and then it sends it down and it loops back up before it goes to the brain as a sensation. So they can get feedback from these areas as well. All right, a little complicated, but it tells you how.
It looks like it's all the places where she says it hurts.
Okay, yeah. So you're getting feedback from all these areas. Migraine stories. So I like telling stories because stories are fun and they're hopeful. So let's tell this story. So my migraine started in December 2011. I was missing so much school. I had to give up on sports. In February 2012, I spent 4 days in Valley Children's Hospital on IV meds that were supposed to help. I threw up all night from the meds. I had a total of 5 days with no migraines. Super happy. It's like hopeful. Yay. 2 days after being released from the hospital, my migraines were back. I spent most of the time in bed sleeping with blankets over my head. I missed out on so much of my 6th grade school year. We had spent so much money looking for answers. Doctors pretty much gave up on me. I heard about Dr. Hobbs, came in for an evaluation and treatment. Within a couple weeks, my migraines improved. It was amazing. As of today, I had only 3 migraines in 6 months. At first, I came in 3 times a week. Now I only need to see Dr. Hobbs once a month. I'm now able to read a book without getting lost and having to reread it. I've improved in proficiency and recall and reading. I'm getting better grades in book tests. Also back to playing sports. Before coming to Dr. Hobbs, I was on so much medication. I love Dr. Hobbs and don't know where I would be without his treatments. Dr. Hobbs and his staff are very nice and caring. For 3 people to see him, I can't say enough good things about him. Tiffany Jones. So that was a great story. All right, so what about neck curves? So let's tell this story. 5-year-old girl diagnosed with migraines 1 year ago. This is actually an old story now, but near total loss of neck curve. So when I saw her, she had been diagnosed with migraines a year before she came in. And she was 5 years old when she came in. So she was diagnosed with migraines at 4 years old, actually by a neurologist right down the street here. And they were pretty sad. This is what we got. And then his approach was basically medications. Try to break the cycle of medications. We saw her and took an x-ray of her neck, and she had almost no curve in her neck. Should be a 25 to 35 degree curve, and she was almost straight. And the parents, of course, how did this happen? We see older people who've been in car accidents, and they've lost a curve in their neck, or they've been in motorcycle accidents, some sports, gymnastics, landing on your head. All these things will cause that. She's 5 years old. Like, where'd this come from? Started at 4. Like, she didn't even fall out of her high chair. They said there's nothing. But birth is actually pretty traumatic too. So very well maybe for her it was from birth. But a month after we started treating her, we took another x-ray of her neck, and the curve was almost entirely returned, which is pretty cool. For older people, it takes a lot longer, and often we won't get it fully returned. With hers, it's all back, and she had no more migraines. Happy story. These are the different causes, but we want solutions. So solutions start at home. And we've already talked about what are a couple things you could do at home that we've talked about that could help reduce migraine frequency.
Say diet first off, because
Diet, okay. You don't have to get too specific because we're on live, so don't tell on yourself too much. But it's good to be vulnerable too, because people are like, yeah, me too.
Diet and probably stress reduction.
Mm-hmm. Yeah, that's easy to say, right? Mm-hmm. Don't be so stressed. Just relax. But we can be intentional about it, and relaxing and taking a few minutes at least a couple times a day, and go, okay, I'm just going to chill right now. I can't do anything about it. I'm just going to chill, and that really can make a big difference. So, and some people take a lot longer to chill, but even a couple minutes is helpful. Yeah. And any of these things are helpful. I'm going to just click through here because that didn't animate the way it's supposed to. All right, we'll start with that one. Where's the pain? So this is pretty cool. You can find out where the source of your headaches is. So where's the pain? If the pain is temporal or the entire head, so temporal right up here on your temples, right? Then are the muscles tender? Let's check the muscles of your jaw and your temple. Are the muscles tender there? If they are, okay, that's a yes. Then if you got muscle toxicity, stress, or joint related. The joint might be your TMJ joint. Stress is emotional stress because we clench our teeth. Here's a little pro tip. If your teeth are touching, then you've been clenching. So it doesn't mean you've been grinding your teeth. That may be the case. But as you go throughout the day, you need to check yourself, are my teeth touching? Because even a little, just like a little bit of bad ergonomics, those muscles are tense. In this case, we're talking about muscles here and here, your jaw closers. They're going to be basically holding their breath because the muscles are tense. It reduces blood flow, waste products build up, oxygen, nutrients can't get in. I want to check on that. So are they tender? If they are, then we're looking at muscle toxicity, stress, and or joint-related problems. If it's no, and it also can be muscles down here. This is another the muscles. If you reach out, go ahead and do this. Reach over your shoulder. You can see me. And this upper trapezius muscle, especially along out here, but anywhere along there, they can feel that bony ridge down there. That's where you want to press on. These muscles may refer pain up into the head. And if we're looking at that, then it's still muscle toxicity, and that may be ergonomics. So food sensitivity, if it's no, though, if it's not tender in any of these areas, then food sensitivity, systemic inflammation, deficiency, toxicity, or rebound headaches. There's a lot of other things it could be, but it's not likely muscle toxicity if they're not tender. What if it's a suboccipital or neck. Suboccipital, this is your occiput, is this bone, your base of your skull. So what if it's coming from here? Where's if the pain is here? So my headaches are in the back of my head. If it's on both sides, then it can be stress, like your curve of your neck, stressing the ergonomics, or sorry, not the ergonomics, stressing the biomechanics. If you don't have a curve in your neck, then just holding your head up is stressful and the muscle is going to be more tense. Also ergonomics, if your head's too far forward, if your shoulder's up, those are things that can feed those tension, cause tension. So if it's both sides of the suboccipital area, then it's probably stress, neck curve, ergonomics, causing muscle, joint, and nerve. All three of those are involved in this case. But what if it's just on one side? Then it's probably joint dysfunction or ergonomics. What's joint dysfunction, right? That's when they need to be adjusted. You have a spinal joint problem. Or ergonomics, especially if it's on a side that you're holding the phone or you're doing your mousing or keyboard, that one-sided, this is where we look for those. And then it's because it's causing these problems. What if it's around your eyes? Your sinus is tender. So you press 3 places. You can press right up here. And if it's tender, then the sinus is part of the problem. Also the maxillary sinus underneath your eye here, you press there. If those are tender, it's like, oh, that's a sinus problem. And if it's yes, then it's sinus or allergy. What do you do for that? I like the sinus rinses. It used to be 10 years ago, nobody recommended that. Now it's all over the place, and the ENT doctors recommend it. So I'm really. Neti pot is one of those.
Oh,
yeah.
I'm so scared of doing those.
Really?
Yeah.
¿Por qué?
It just seems really scary. I haven't done it before, but I've heard it's good.
Yeah, yeah. It's. Yeah. There's nothing to fear. Now there's there's another one. It's kind of motorized, like a Navage. That's what it's called, right? That one seems a little scary, but I think it's probably really safe. But it just thinks about some motor pressing water through my nose. So I think it's safe. It's not like I imagine it. But the other ones the passive ones are fine too. So neti pot. And we have another one we recommend. It's a little bottle with a tube coming off, and then it angles up, and you stick that part in your nose. That was my wife's vote for her favorite one. I forget the name of that one. Those are good. So sinus rinsing. If it's a sinus issue, then rinsing those irritants off your nasal passages is really helpful. Because if they sit there all night long, kind of poking at you, irritating you, right? That's gonna be a problem. And we get allergens on us all the time. And then we go, if we don't wash our hair, which is a hassle for ladies who have so much hair. Some guys have so much hair, and that's a hassle to wash your hair. But if you've got these allergens sitting on them, and then you lay down in bed on your pillow and you rub the allergens all over you're not really rubbing them over, but you do just by laying them down. Now you have allergens all over your pillow, and you're sleeping on the allergens all night long. Yeah. Okay. So that's that one. What if no, sinuses are not tender? It's around your eyes, but the sinuses are not tender. Then would you have pain after reading a long time in any position? What does that mean, in any position? Well, ergonomics can cause irritation if you're reading with bad posture. You're like, no, I have great posture. It's just reading. Then you think about glasses. Maybe you're farsighted. Look at this cool glasses I put on him. He looks like Urkel. But if it's no, like I don't have pain after reading, my sinuses are not tender, and I don't have pain after reading, then go back to jaw muscles. Are the jaw muscles tender? Because they can refer pain up into the eyes as well. Jaw, actually temporal, jaw, or suboccipital can all refer pain. Sometimes I'll press somebody back here in the suboccipital area, and they're like, I feel that in my eye. It's kind of weird. There's no nerve that goes from here to here, but it can refer that pain straight through. Okay. And then if it is, then it's muscle toxicity, stress, or joint related. And if it's no, well, then we go back to food sensitivity, systemic inflammation, deficiency, toxicity, or rebound. And you can have more than one. So you can have food sensitivity or systemic inflammation from diet, and you can have problem with your eyes or your sinuses, or maybe that's contributing to problems with your sinuses. You also have posture issues because your ergonomics. It's possible to have 3 or 4 or 5 things. that's what synergy is about, is recognizing there can be multiple things, and sometimes we have to address all of them. Sometimes we just address one of them. That's why I talked about that big list for migraines. You just start going down. It's like, oh, we fixed one. Yeah, and now you're good. You're like, I wish I had that problem. That's actually how it happens often. We get one or two and then we're good. But we may have to do multiple. It's like if you're sitting on 4 tacks and you remove one, you're like, no, that didn't really help. You're like, no, it really did help. Like, it didn't help. Still hurts the same. You remove another one. It's like, now we're 50% better. It's like, no, I'm not. I'm like 0% better. You have to remove all the tacks sometimes to get relief. So self-help for headaches. Rebound, what do? We went through all. I'm going to go through this quickly because we went through it. And if you guys want a copy of this, you can get it, or you can see the video and review it. So rebound, wean off the caffeine and caffeinated medications, because caffeine itself can cause rebound headaches, just like caffeine medications can. Ergonomics, fitting the workstation to the worker so the strain, irritation, and injuries are reduced. Muscle toxicity. Massage or trigger point therapy. May need chiropractic if joints are causing the muscle toxicity, but massaging the muscles. So if it's these, we talked about these muscles here, just massaging them is a great, like, I do that. Right? So it's good. If they're tender, they're toxic. Stress, this emotional stress, improve events. Yeah, so just make your life better. That'd be nice. And sometimes that means people. It's like, yeah, I can't really be around you. So. And or perspective, view of the situation. There's a great book. It's called How to Stop Worrying and Start Living. It's by Dale Carnegie. Dale Carnegie also wrote the book How to Win Friends and Influence People. It's more popular. But the How to Stop Worrying and Start Living is super cool. Lots of stories. I was driving back from a seminar in San Francisco one time, early morning, because I had gone to the seminar over the weekend, driving back for work. And I missed my turn by 2 hours. I was like, it's only 3.5 hour drive. Because I was just totally into the book. Right? I'm going to turn the air down. It's getting warm now. All right. There are 7 synergistic steps we apply to improve healthy nerves, muscles, vessels that are causing headaches and neck pain. So find the cause. How do we find the cause? Well, we look for all those causes we talked about, testing and examining, and then we decrease dietary interferences. What are those? Bad foods. So first, start with the foundation of a good diet. I think the MIND diet, M-I-N-D, is a really good place to start. It's basically a Mediterranean type diet with some more berries. And then food sensitivities. Food sensitivities may be good foods that you respond negatively to. So, for example, if somebody has a gluten sensitivity, then that can be the problem. But it can really be any foods. Increased dietary healers. That's just good foods. Essential fatty acids, lots of greens. Again, things that are going to be in that Mediterranean diet. Supplement as needed. There's some good foundational supplements that are good. I call them the core 4. And these need to be quality, but basically they're multivitamin and mineral, essential fatty acid, like fish oil, probiotic, beneficial bacteria for your gut, and phytonutrients, just like a greens smoothie kind of thing. Restore body neurology and structure. So this is chiropractic. Move and use your body correctly. That's ergonomics. And reevaluate the cause. Once we've done that, we go, okay, now what are we left with? Is there anything that we need to dig in deeper on and make it better? Professional need for headaches. So we talked about some home needs. These are some professional help. Joint nerve dysfunction, that's corrected by chiropractic adjustments and reducing the cause. So we always want to go back to the cause, which is stuff that happens at home and work. Neck curve, corrected by chiropractic adjustments and device that helps you work on at home to restore that curve. Food sensitivities, inflammation, deficiency, toxicity. We can diagnose it more by functional lab testing if we want to know really what exactly is going on with you. We can start with that foundation of the core 4 supplements and MIND diet. If you're like, I'm still having problems, we can test for food and chemical sensitivities. We can also test for deficiencies, toxicities, gut health, things like that. This is a 2-minute, 10-question healthy brain self-diagnosis. So this is not just for migraines, but it's for healthy brain. I'm not going to go through all this, but it's a little questionnaire I can give you guys. It asks, the way you would read it is, let's go through number 1. Physical exercise, 3 hours per week at moderate intensity. If you do that all the time, which is 90% or more of the time, then you give yourself a 5. If it's most of the time, 80 to 90%, then we give yourself a 3. Less often than that, you give yourself 0. Mental exercise. Have a college education? Are you what? This is what's the word I'm looking for? Not racist, right? But it's biased or something like that. But it's true. It's because learning or multiple languages. So in America, most of us don't know multiple languages. So Europeans have this over us, and that they all learn 2 or 3 or 4 languages. That's actually super good for your brain. But what it does, it gives you what's called cognitive reserve. So it's extra brain that you can lose. We're all going to get these lesions in our brains eventually. We start getting holes in our brain. We turn to Swiss cheese. But the more dense our nerve connections are to start with, the more it doesn't matter if we lose a little brain. A little brain here and there. It's good. So that does matter. And college education is just one way to measure it. Although that may not be true anymore. College education is not what it used to be. All right. Enough said there. So anyway, that's how you use it. This is really good. This is for dementia, all the brain disorders. Super good for it. Scoring your brain. So once we score that, then we go, okay, if I have 22 to 35, then I'm improving or doing pretty good. Lower numbers, things are worse. And then we apply that to what we eat, drink, breathe, think, move, and sleep. So there's 10 steps to improving your brain health and preparing for headache healing. Physical exercise. This basically applies those same things we just went through on that questionnaire. You take a picture of that? That's a good one.
Do you have your phone on you?
I can send it to you guys if you don't. So physical exercise, 3 hours per week at moderate intensity. Now, you might be able to get that shorter if you do intervals. And so you go intense, it goes intervals, right? So you go intense for 30 seconds or so, and then easy for 90 seconds, intense for 30 seconds. You can actually get your time down shorter. Mental exercise, mental stress. You don't want to have too much mental stress. Sleep 7 to 9 hours a night. Don't smoke. There's no way out of that. And we used to think, so the new, a lot more people smoking pot these days, right? And that's, we thought, well, a little bit here and there is not a big deal. But pot today is not the pot of our parents. Things have changed a lot. And there's not studies on the new stuff so much. But they are finding that it's causing some brain problems that all the people kind of suspected before. But not just lung problems, but brain problems. Eat fast food. What? This is awesome. No, less than 2 times a week. Really, less than that is better. But and you can there's not all fast food is equal. Chipotle, all right, that's pretty good. Maybe not even fast food. Eat and drink sugary, sweet. Yes, more good. No, less than 3 times a week, and that's still pretty generous. So you wouldn't want to eat a lot. It's like, I only have a pint of ice cream 3 times a week. It's like, that's pushing it. We're talking about a serving. Drink 1/3 of your body weight in ounces of water. What does that mean? If you weigh 150 pounds, sorry, third of that would be 50. I don't know 8 ounces of water. Wow, this is crazy math. But that'd be 6 times 8 is 48. That's about 50. So that's where you come up with the third of your weight in ounces of water. Eat fish 3 or more times a week. What kind of fish? The cold water fish is the best. Salmon, cod, halibut, sardines are good too. I'm a little suspicious about the sardines in the cans for so long though, right? With the plastic stuff in the can. Sardines are super good because you eat the bones, you eat the organs. Sardines are awesome. But eat non-grass-fed beef or pork servings less than 3 times a week. So grass-fed is pretty good, but your non-grass-fed You don't want to eat it at all if you can do that, but not so much because it has its own problems. And then pork, it's got problems too. And eat berries and green leafy veggies more than 4 days a week. Okay. The migraine solution discovery process. This is what we do in our office. We do a full evaluation for somebody. We do a scan of their spine and nervous system. We sit down and we take a history, right? Sit down and was like, what have you tried? Has anything worked? And if there's something other than medication, which just blunts the whole natural process, if there's a time or a thing that's like, yeah, I was really good at this point, and then I got bad again. I'm like, even for a short season, it's like, well, that's the place we can get you. That gives me hope that you've already done it. We just had to figure out what you did. So that's part of what the history is about. So your symptoms and history, spinal motion palpation, that's where I use the hands to feel the spine. We feel the curve of the neck. And we want to see that this guy doesn't have much of a curve, but he's dead, so he doesn't have a great example. There should be a nice curve in the neck, but like there is the curve in the upper back and lower back. So we do a scan. This one here is to check for the electrical muscle activity along the spine. It should look like this, and this is a typical scan where there's a lot of underactivity. Second part of it is structural and neurological testing. We'll talk about trauma, treatment recovery, structural, chemical, mental issues, and then analyze a metabolic assessment form. This is a questionnaire that helps us to know if there's different systems of the body, the gut, the adrenal gland, the thyroid, things that may be contributing. Neurological testing, we'll check for the autonomic nervous system health. Heart rate variability. You guys heard of heart rate variability? So I'll tell you a little bit about that because it's super cool. This is a measurement of your body's ability to adapt to stress. The purpose of the nervous system is to adapt to stress. And so we want that to be working really well. Heart rate variability. If you had a car going down the road, you're looking at a car, and I said, okay, I want you to determine if that's an automated car or is a person driving that car. The windows are blacked out, and you could drive along beside it, and there's not much traffic, and you could know its exact speed to the 10th of a mile an hour, but that's pretty much it. You just watch the car and know those numbers. Which car would have more variations in speed? The one driving by a person or the one automated? The person would have more variations in speed. So you've got a real brain, a real person paying attention to what's going on. And at this stage of self-driving cars, I would consider that more safe, generally. So, and that's the same true with our body. We want our body to be controlled by a brain that's paying attention, not one that says, hey, we'll put it on automatic and you're good to go. I'll come back later. And that's what happens when we're stressed, when we're under chronic stress especially. Our variations in our organ functions decrease. They stay the same. And then we can measure this in the heart. You could theoretically measure it in the liver, in the pancreas, the intestines. Like the intestines pretty much shut down during chronic stress, acute stress especially. They stop functioning, and so they're really steady at 0. Of course, the heart rate's going to be higher, but here we're not talking about heart rate, we're talking about heart rate variability. So when you're sitting there at rest, is when we measure this, you should have a lot of variations because the brain is going, oh, let's do a little faster here, a little slower here. Yeah, let me just fine tune. It's like a chef in a restaurant versus a McDonald's cook who's like, oh yeah, I'm a great cook. I do the same thing exactly every time. Every restaurant you go to is going to be exactly the same. And you can depend on it, but it's never going to change. Whereas a fine chef, it depends on what vegetables are available, fresh that time of year, all that. That's what we want in charge of our body, is a brain that's really paying attention. So when we do heart rate variability, we want a lot of variation. That's a measurement that the brain is paying attention and is not stressed out. Right? So a lot there. Yeah, so we'll do x-rays if needed. This is postural analysis. This poor girl got hit hard. This is like when we do TBI, traumatic brain injury, mild traumatic brain injury especially. She might have had a little more than mild traumatic brain injury. But we'll check eye movement accuracy. This is things that are important. Checking neurological function. We'll also check the feet, and then we'll take x-rays as needed. Part 3 is results report. We go over the findings, and we'll often do a therapeutic trial adjustment. What does that mean? We do one adjustment to see how well your body responds. this little clicker here changes what people see on the screen. There we go. Now they can see the whole me. Right. We go with the results. We do a therapeutic trial adjustment, see how well their body responds. Had a patient just the other day. She came in. Poor thing. She was anxious and in pain, and it was palpable the amount of stress and anxiety she was in because of her pain, and she was kind of concerned about getting an adjustment. And honestly, I was a little concerned about giving her adjustment too. When somebody's in a lot of pain, especially chronic pain like fibromyalgia, they'll increase they can't handle the good input. It's like exercise. They feel worse with exercise often, but exercise is something important. They just have to do it the right amount. We call it the metabolic threshold. Metabolic is basically the functions of the body biochemically. Can they handle something good? Yes, they can, but we have to give them just the right amount. Anyway, we did the adjustment, and both of us were like, yeah, I don't know how your body's going to take that. And she's like, yeah, I don't know if that helped at all. Like, that's a bummer. Because almost everybody gets a really good response. They can feel how their nervous system's working better. Her, she wasn't really sure. Then she came back for the next appointment, and she said, my shoulder was so much better, still is so much better. I'm like, this is really good. She said, my nervous system was a little irritated for a day, but then I was definitely better. I'm like, great. Her body can handle that. If she couldn't, then we'd say, well, we'll probably have to do lab work first or nutritional work first to decrease that systemic inflammation, because she can't handle the adjustment. She can't handle that input to the nervous system. It's just too much. That's how we approach that. So we'll look for things like deficiencies, leaky gut syndrome, toxicity, and more. During the workshop, we make an offer. So if somebody's watching, you can do this to yourself or your friend, and we do it for a week. So usually we'll charge $275 for all of that, which is pretty good. We'll do it for $105, not including lab testing, for anybody who wants to be evaluated. And if, let's say it's not migraines, that's okay. We would still offer that. Now, as a patient, you already have an offer that's better than that, so you can give him something even better. Our certificates over there. But for those of you listening, this is your in. And then, so if we do lab testing, again, it's not included in that, but we'll look for things like nutritional deficiencies, antioxidants, B vitamins, minerals. We check for a lot of things to find out if your body has what it needs to do what it needs. That's the last slide. So, do you guys have any questions?
It's a lot to take in.
It is. Or comments. You can have a comment too.
I'd definitely be interested in getting as much of these slides as I could.
Okay. I will give them all to you.
As much of the information.
Yep.
I should say.
Okay.
Because it was a lot. It was all good information. It's like, okay, let's implement all of that right now.
Yeah.
Because I think the medicine was making it worse. Like, because what were you saying, there were the worst migraines that you had in a while. And I feel like they weren't that bad.
Before that,
for a pretty good while, yeah. And then when they switched to that new medicine, kind of ramped things up. It seems.
Yeah.
All right, I'm gonna close this video out. If you guys want any more information, give us a call at the office, 559-635-8266. So have a great day, and we'll see you later.